اتفضل.
طيب الليكتشر دي اللي احنا هنقولها عباره عن الجزء بتاع الجينيتكس الخاص بطلبه سنه 5 الاندر اللي هيبقوا من شباب الاطباء ان شاء الله. What's meant by a chromosome normally? Where is the chromosome and what is meant by a chromosome? A chromosome is a number. A chromosome is a part of it is a color, and some is a body. So it is a colored bodies. Where it is present, it's present in the nucleus inside the body cells. These chromosomes are 46 chromosomes or 23 pair of chromosomes. They are 22 chromosome pair controlling the major function of the body and a pair of 6 chromosomes. The pair of the 6 chromosomes are either an X and a Y chromosome, so this will be a male, or a 2X chromosome that is a female. What are the chromosomes? This is a normal karyotype of human chromosome. Karyotype is a picture of chromosome lined up to look at and compare the different colors. The chromosomes are grouped according to their length and according to the position of the centromere. The term karyotype is a systematized arrangement of the chromosome. But the chromosome analysis is not a karyotype. A karyotype is a photographed and arranged number of chromosomes. The pair of 21 chromosomes is so small and is present at the bottom of the figure. These chromosomes are tiny string-like structure in cells of the body that contain the genes. Each person normally has 23 pair of chromosomes, or 46 in all. And this presents the cell cycle division, where the cell begin in the resting phase, which is the interphase, and then the prophase, where these threads, which is like fine meat threads, begin to thicken and enlarge and known as a chromosome. And then they are arranged in a center of the chromosome and attached by a fine threads at the pole of each side. When it is ordered to separate, each pair of chromosomes go to one cell, and finally a cell membrane is formed, and the result is a 2 cells contain the same number of chromosomes, and this is called mitosis. This is the normal chromosomes. Each chromosome is called an upper part above the centromere and a lower part below the centromere. The chromosomes are either a metacentric, a submetacentric, or an ectocentric chromosome. Chromosomal abnormality generally constitute 5 to 6 per thousand the incidence of chromosomal abnormality. These abnormalities are caused by error in the number or structure of the chromosomes. And these abnormalities are either in the autosomes or in the sex chromosomes. The numbers are either increased or decreased. When they are increased, they are called polyploidy, and when they are decreased, they are called monosomy. Many children with a chromosomal abnormality have mental or physical birth defect. Some chromosomal abnormalities result in miscarriage or stillbirth. 50% of spontaneous abortions are chromosomal abnormalities. So the chromosomal disorders are either due to defect as number, the defect in the number, or the defect in the actual structure of the chromosome. And the abnormality are either on the autosome or in the sex chromosome. So we begin first with a numerical defect. Numerical defects are abnormalities of the aneuploidy number of chromosomes, that is 46. The normal number of chromosome is called aneuploidy. If the number is increased but not the double of aneuploidy, it is called aneuploidy. Example of aneuploidy is trisomy 21, which is Down syndrome, or trisomy 18 and 13. Abnormality in the sex chromosomes are either Klinefelter syndrome, which is 47 2XY, or Turner syndrome, which is 45 and only one X, and the other X is mostly absent. Structural defect in the chromosome result from breakage and rearrangement, and these occur either in the autosome or in the sex chromosome. Possibilities include unbalanced translocation, that is part of the chromosome is transferred to other chromosome, or deletion, which is loss of a part of the chromosome, or a duplication, that is a repetition of a segment of that chromosome. Inversion, it is upside down inversion of a piece of the chromosome. Isochromosome and centric fragment, that is the centromere is divided transversely instead of longitudinal, so there is a loss of two arms of either the P, which is the small upper part of the chromosome, or of the Q, which is the lower part of the chromosome. Example of these syndromes is the Cry-Duchat syndrome, which is the 5X deletion, chromosome number 5, loss of the long arm of the chromosome 5, or Wilms tumor with ameredia, chromosome 11Q deletion, or the Prader-Willi syndrome. So this is single chromosome disorder. This is deletion, portion of the chromosome are lost, so the genetic material is missing. Duplication, the genetic material is present twice. Inversion, part of the chromosome are flipped and genetic material is doubled or inverted. What happened to these cells? Genetic material is added from another chromosome, so this is a translocation. When cell goes through meiosis, part of the chromosomes stick together and switch. The material is swapped with another chromosome, so this will interfere with the normal division, result in chromosomal aberration. When to suspect a chromosomal abnormality? If there is unexplained infertility, if there is multiple abortions, 2 or more, prior case of defective baby, presence of congenital anomalies, mental retardation, multiple congenital abnormality, or dysmorphic features. 45% have minor single anomaly, 9% have 3 minor anomaly, 1.5% have major anomaly. 2 or more major anomalies may represent genetic syndrome or chromosomal abnormality. Classification of chromosome disease, sex-linked abnormality, and this is an aneuploidy like Klinefelter syndrome, or monosomy like Turner syndrome, and multiple of the X, which is aneuploidy like triple X or 4X or 5X, and autosomal inheritance. The most common chromosomal abnormality, autosomal, is trisomy 21 or Down syndrome. The name Down, this is attributed to the doctor which discovered the syndrome, which is called John Langdon Down syndrome. name. It's the most common autosomal trisomy compatible with life. Type of defects, it is a trisomy 21 in 95% of the cases. Some cases result from translocation, and more rarely, some of the cases have normal cells and some are abnormal, and this is mosaic. The picture below shows a triple 21 chromosome. And so the karyotype will be a 47 XX plus 21. This is 3 21 chromosome. So this is a female, or a 47 XY plus 21 extra chromosome. This is a Down syndrome in male child. And this is a picture of the karyotype with Down syndrome, and here is the 3 chromosome at position number 21. The risk correlate with the maternal age, and when the maternal age exceeds 40 years, the incidence will be 1 in 80 or 1 in 100. While in young ladies, the incidence will be 1 in 1,600, or when the age became older, in 30 years, it will be 1 on 800. The clinical feature of Down syndrome, number 1 is the characteristic appearance with dysmorphic features. Generally, there is hypotonia with tendency to keep mouth open, and the tongue is protruded. The tongue is protruded because the oral cavity is small. Excessive mobility and flexibility of the joint due to hypotonia, and a relatively small, short stature with awkward gait. Central nervous system abnormality, the main and the major defect is mental retardation, and the mean IQ is around 50. So it reflected as a developmental delay, hypotonia, Alzheimer-like dementia, sign of hypothyroidism. All these contribute to the mental retardation, and later is blood disease like leukemia. This is a feature of Down syndrome. So the craniofacial anomaly, we have a microcephaly, that is small circumference of the head, a brachycephaly, that is the back of the head is flat, and the occiput is flat, a flat facial profile, a short upslanting palpebral fissure, and a small nose with flat nasal bridge. On the eye, there is a brush-filled speckled spots of the iris and inner cancer fold. The mandible is small, and the mouth cavity is small, and the tongue is protruding. The ears are small with abnormal shape, and later closure of the autonomous. This is a picture of Down disease, and the first one is the flat facial appearance and the brachycephaly, and then in the middle is the slanting of the palpebral fissure and the protruding of the tongue and the small ears and the flat faces, and the third one is the hand with short, broad hand with a simian crease and clinodactyly and stubby fingers. This is Down syndrome, and here there is a glasses because he has an ocular abnormalities, which may be the defect in the cornea or in the increased intraocular pressure, like glaucoma or cataract. The skin is also rough, and this child is also mentally retarded. The face is small, round face, and the tongue is protruded, and he is also, lifespan is short, and he is also a happy baby in spite of this abnormality. This is the palm of the patient with Down syndrome. We see the senior crease, the distal axial triradius, and the small little fifth finger with clinodactyl. And this baby is a little bit cyanotic. He has a congenital heart disease like PDA, VSD, ASD, but the most common is the atrioventricular septal defect, that is the AV canal, which later will lead to pulmonary hypertension. This is an X-ray of the baby. The heart is enlarged and the apex is lifted up from the diaphragm due to enlargement of the right ventricle, and there is a thymus on the other side. So the principal feature in the neonate very early, number one is the hypotonia, and the poor moro reflex, the hyperflexibility of the joint, the excess skin on the back of the neck, the flat facial profile, the slanted palpebral fissure, the anomalous auricles, the dysplasia of the pelvis, dysplasia of mid-phalanx of the fifth finger, and senior crease. The cytogenetics is either non-disjunction, when cells go through meiosis, the chromosomes don't separate correctly, and either too many or not enough are passed on. In the mosaic, refer to the presence of two or more cell lines with different chromosome composition in an individual. Mosaic occur as a result of chromosomal non-disjunction after fertilization. When cells go through meiosis, the chromosomes do not separate correctly, and either too many or not enough are passed on. The genetic changes is not carried by parent, so the risk for recurrence of a child with mosaicism is usually negligible. This is a Down syndrome patient. With early intervention and special education, many learn to read and write and participate in various childhood activities. So we go to shift to other trisomies apart from Down syndrome, like trisomy 18, which is Edwards syndrome. The incidence is 1 in 8,000, and so it is not common. The main features also is severe mental retardation and many physical birth defects. 90% are dead in the first year. This is Edwards syndrome. Trisomy 18 is severe birth defect with mental retardation, and there is 3 chromosomes at position 18. This is Edwards syndrome. Before birth, there is a polyhydramnios with a small placenta and intrauterine retardation. The craniofacial dysmorphism with strawberry-shaped head, microcephaly, micrognathia, and small mandible. And here is the profile of the small face with prominent occiput. The other features of Edwards syndrome is overlap of the second finger on the third, fourth finger on the fifth. The third and fourth are overlapped above the fifth finger. And there is fixed finger contraction. Trisomy 18 has a weak cry, a small sternum, small nipples and pelvis, and hypoplasia of skeletal muscle with subcutaneous and adipose tissue loss. Other abnormalities in the heart, like congenital heart disease, VSD and PDA, and the kidney, horseshoe kidney, and umbilical hernia, which is large, that is omphalocele. And this is the small sternum and the small nipples. And this baby is in the ICU. Abnormalities of the feet, which is a long feet, a rocker bottom feet, and the genitalia is small, that is hypogonadism, small penis, and cryptorchidism. Other trisomy is trisomy 13 or Pateau syndrome, with also severe birth defect and mental retardation. And here the abnormality is in the chromosome number 13, 3 chromosomes. In trisomy 13, there is a midline defect. Number 1, there is a triterine growth retardation, open scalp lesion called scalp defect, and cutis aplasia. Cleft palate may be bilateral, microcephaly, malformed ears, microphthalmos, and coloboma of the eyes. This is a picture of a Pateau syndrome with variable defect in facial development, microcephaly, and cleft palate. And this abnormalities in the fingers, the fifth finger is double and overlapping the other fingers. The result is a polydactyly of the fingers. In a marked CNS malformation and the midline brain defect, and sometimes a hollow prosencephaly, is more severe mental retardation than the other symptoms. Also, he has congenital heart disease with variety of cardiac defect like VSD, ASD, and TG. And this is the karyotype of the Pateau syndrome, where the chromosome number 13 is 3 in numbers. This is one of the trisomy 13 in the ICU. And this same when he is growing up with a mentally retarded and with a glasses because of the myopia. Newborn baby was diagnosed Pateau syndrome with a cleft lip and palate and polydactyly of the left hand and atrial defect. So he is put on the ICU. And here is this baby when he is 5 years old with Pateau syndrome with congenital deafness and blindness. The prognosis, 50% of patients die before 1 month of age, 70% die before age 6 months, and 90% die before age 1. So we are shifting to the 6 chromosome disorders, and these involve abnormalities in the number of the structure of the X or Y and in the number. In the number, Turner syndrome with a missing X affect 1 in 2,500 newborn girls. So every girl with short stature, you should think of Turner syndrome. 1 X chromosome is either missing or abnormal. In 55% of girls who have Turner syndrome, there is a 45X karyotype. In 25% of patients, the structure of one of the X is altered, that is defect in the structure of the chromosome, whether it is a deleted part or a duplicate part. In 15% of patients, a mosaicism, that is 2 different cell lines. And prenatal diagnostics of Turner syndrome include a blister hygroma of the neck and edema of the fetus. This is a prenatal or ultrasonic diagnosis. And this is a short a female with broad chest, with wide space of nipples and congenital lymphedema. The features are dysmorphic, and there is swelling of the back of the hand and feet at birth, wide shield-shaped chest, webbing of the neck, appearance of short neck, low posterior hairline, cubitus valgus, increased carrying angle, short stature, a height adult is 135 centimeter, and multiple pigmented nevi. This is Turner syndrome, that is X0. Here there is a marked webbing of the neck on front and on a lateral profile, and there is a lymphedema of the feet. Functional and structural abnormalities in Turner syndrome. There is gonadal dysgenesis, is present in 100% of patients, is associated with primary amenorrhea at the time of adolescence and lack of pubertal development due to absence of ovarian hormones. Females are unable to become pregnant, and they are liable for a gonadoblastoma because tumor of abnormally located gonads with Y containing cells in patients who have a cell line with Y chromosome are mostly liable for gonadoblastoma. This is a congenital anomaly of the uterus and testes. Renal anomaly, 40% include duplication of the collecting system and horseshoe kidney, congenital heart disease, ASD, bicuspid aortic valve, dissecting aortic aneurysm in young adulthood may be a serious complication, and the thorax with broad chest with widely spaced nipples that may be hypoplastic, often mild pectus excavate. These are a different variety of Turner syndrome. In one, there is a webbing of the neck, and then when they reach adolescence, they are short in stature with wide spaced nipple and wide carrying angle and absence of secondary sex character. Prognosis depends on the type and severity of malformation, and the lifespan probably normal in most cases. أخذ أرست شوية وبعدين. We will shift to the other Y chromosome abnormality, and this is a picture of a Klinefelter syndrome. The Klinefelter syndrome is composed of a hypogenitalialism and hypogonadism, long legs, abnormal mentality, and abnormal behavior. 80% of the children with Klinefelter syndrome have a male karyotype with an extra chromosome X. That is XXY, and the number is 47. 20% have multiple sex chromosome aneuploidy, 48 3X and 1Y, or 48 2X and 2Y, or 49 4X and 1Y, or mosaic 46 over 47. 20% of aspermic adult male with blocked spermatogenesis are Klinefelter syndrome. And this is a karyotype of Klinefelter syndrome with 2 X's and 1 Y. Klinefelter syndrome with the puberty occur at the normal age, but the testis remains small. Patient develop secondary sex character late. 50% develop gynecomastia. They have taller stature because many patients with Klinefelter syndrome are phenotypically normal until puberty. Phenotypically means that he is like other people's. The syndrome often goes undiagnosed until they reach adulthood, when their infertility aids in their clinical identification. Patients with 46 XY over 47 2XY have a better prognosis for testicular function. This is a feature of the photographs for Klinefelter syndrome. Number A is a 9-year Klinefelter with 2X1Y child. Note is small penis, long legs. Number B is a 16-year untreated 2XY adolescent. Note the gynecomastia and the scoliosis. Number C is a 21-year untreated 2XY Klinefelter adult. Note the obesity and hypovirilization. The intelligence of Klinefelter syndrome show variability and ranges from above to below average. Person with Klinefelter can show behavioral problems, learning disability, and defect in language. Problems with self-esteem are often the case with adolescent and adult. Substance abuse, depression, and anxiety have been reported in adolescents with Klinefelter syndrome. Those who have higher X chromosome count show impaired cognition. What is impaired cognition? That is a mental disability. It has been estimated that each additional X chromosome reduces the IQ by 10 to 15 points. And when comparing these persons with their normal sibling, they are below them. The main effect is seen in language skills and social well-being. Other abnormalities, we are shifting to the structural abnormalities, that is the deletion. Deletion, we have to say just the common deletions, which is a 5P syndrome or cat cry syndrome, and it is also contain a low birth weight, less than 25% kilogram in 72% of the cases, a slow growth, a cat-like cry, mental deficiency, and hypotonia. Deletion number 5P chromosome, here this is a photograph with a microcephaly and with a downward slant of the palpebral tissue. Clinical feature beginning in the newborn period and suspected with the motor features in the first few months of life. Children affected with this disorder have a strange cat-like cry that is caused by a laryngeal hypoplasia. Prenatal diagnosis of chromosomal disease is either by a non-invasive method or by an invasive method. The non-invasive method would be the abdominal ultrasonic, or here is a picture of the abdomen, and when we suspect physical signs of in the ultrasonic diagnosis, we go to the invasive method, which is amniocentesis, and when we take a culture from the chromosomes and or the chronic villus sampling, the abnormality will be revealed. Thank you for attention. Maternal screening is either taking a blood sample from the mother during pregnancy and to do a triple test, which is a fetal alpha-fetoprotein, the chorionic gonadotrophin, and the steroid level. And this is called the triple test, maybe a quad test or a penta test. Number 2 is a DNA analysis of the fetal cells, which are going to the blood of the mother, and so we can analyze the DNA of the. This is the early detection of prenatal diagnosis of chromosomal abnormalities. And thank you.